Let's go. All right, so for this demo, shoulder and side lying, especially when we're thinking about like shoulder girdle, getting all of the different points can be a little bit funky and it doesn't make as much sense because like how do I poke into here and do whatever? That is much less efficient. So there is a technique, and with this, it's Y equals yes. So your arm's out equals yes, X is no. What that means is if I'm doing a technique here, and then let me have your arm. So I'm here, so I have my arms a little bit open. Yeah, your arm is heavy. So having arms here is great because I have that open. If I had this here and we're trying to do this, you can see that my arms cross, which means no. So you can just think about it that way because that's just awkward and your access is typically worse. So the techniques with this, doing like pec minor and all that, so you have this cradled, so essentially little elbow joint to elbow joint, just to have as much control as you can. And I would put a little bit of compression in through here, getting some mobilization. I feel like this shoulder is guarding a little bit.
A little bit, yeah.
Yeah. We're just giving a little bit jostly, seeing what the arm will let us do. And sometimes that will happen with clients. I'm just trying to get all of the motions kind of around here, and then I'm even shifting the shoulder blade back along, like into retraction. You can bring it up into protraction, but we'll do that on the other side because it's a lot easier and a lot cooler that way. So going here, what I would do is take and get a little pin, anything that you can going for pecs, and start working in through. And most of my work, my fingers aren't moving when I'm doing this. I'm just shifting the arm and the shoulder around. You can even bring this, relaxy. There we go. If we're here and we want to do a nice little pin and stretch for that, we can shift ourselves around, and you'll see that my arms are open here, so I have the Y, because doing it crossed would just be really difficult and kind of weird. So this, taking, your arm doesn't want to let go at all. Yeah. So that, working through pec, but this is usually the best position, a little bit at an angle. You can get into pec, you can find a long collarbone. You can work pec major by getting into some attachments along the sternum and then just sinking yourself back. And again, my fingers aren't doing work here. They're not sitting, crunching in. I'm just finding a position, sinking into tissue, and then working cross fiber, with fiber, whatever I can find that feels useful. The other portion of this is, yeah, supra and upper traps here. So usually you can get like little pinches and stuff going there, and like that's fine. I can also bring in compress with your palms here. Keep it shortened. Get a little bit of dig into there, and just do a sink down.
That's awesome.
And you can see my hands and arms are just staying in the same position, and my hips are just coming back, and I'm just sinking into it with my weight. And that's all it takes. I can just hang out here if I want. I can add little bits of motion, even little bits of rotation with things if I really want to. There's not a lot of mobility just being in that position. But yeah, so that's a cool thing there. That little thing. Another thing from this side, if we have our hands open for yes, there are all of the things along the lateral border of scapula. So we can get here, pin in, start moving around. We can get little pin and stretch going along there. We can pin down here and bring it back to here. So there's a lot of fun side body to be done here. So that's with my upper hand, holding this up and above, finding whatever little position I can, and starting to move around. Just moving the scapula with me. That will shift the tissue in and out from underneath your grip. And it's not a hard grip. I'm just coming in to engage and then shifting myself across. From the other side, have you sweep over there. Mike, if I may have you scoot towards me. This is a very wide table. Thank you. All right. And then same thing applies here. Y equals yes, X equals no. So with this, I would think, oh, that feels weird because I'm crossed. So bringing this over to here and getting that medial border, get your hand set. You can bring that up over, and you can actually get not direct, but pretty close access to like some medial portions of like subscap stuff, serratus anterior, because it attaches along here. You just get a lot of mobility with scapula doing this sort of work. And it's pretty easy to do in general. Let me think of anything that works up here. Ooh, that could be even better. Yeah, that's better. That's why that felt awkward. Yeah, so this can be just anything you want, just getting the hands in, fine, sink into tissue, and you're just shifting around. The fingers aren't doing the work. They're just staying sunk in and being dragged across through with tissue. And the move of doing this is not as easy or good on this side. I'd usually just do that from behind them. All right, so quick transition, Mike. We're gonna go into a prone position here. Yeah, just toss down. And little fake bolster for this. All right, so frog leg, another wonderful position that I don't know that you've had a lot of experience with. You can do this with the arm here. For the sake of this, I'm gonna bring the arm up here just to have it out of the way. And with frog leg, getting into that position, I would bring the leg up, get the knee scooped underneath my palm. So I'm just cupping that there. And the easy way to do this, if you have a drape that you have to pay attention to, you get the drape, hold it in place, and it's just a shift out. And that will leave you in place. Sometimes angling this lets the leg sit a little bit easier, like kind of has that in the crook of the ankle. So along all of this, you've probably seen the like going through with loose fist. You can do compressions either down. I would avoid too much pressure directly towards the anus because you can create sensations and people can get an idea of what you're doing. And it's not what you're doing. It's outside of your scope. So compressions a little bit down towards the table, or don't press towards anus or genitals. Yeah, the direction of pressure should not be directly towards that. Yeah, because that can create sensations, and then you are working outside of scope and can be, yeah. Yeah. So getting in here, you can lock your arm in and get a little bit of pressure sideways to do compressions along kind of lateral, a little bit anterior portion. It's one of my favorite ways to get through there. All of this can be done through the sheet. It can be done with the glute undraped. It can be done fully clothed here. There's also getting in with your elbow. With the elbow, generally, I find that this top one, so right, when I'm on this side, it would be left on the other. Getting the line shooting in between trochanter and iliac crest here tends to be a good way to get little strokes along. This is mirroring what Asa did in side lying. So you're finding like iliac crest, and you're just doing little scoops along there. I'm just starting along the edge of whatever bony landmark, just doing a little scoop down. We're just doing that, and we'll find greater trochanter. Same thing. We can even just trace up and around. Just keep working trochanter. Go that way. One that, if you can do it, can be great. If it's not comfortable for your body, please don't. So it's coming in here, and I have this stacked. I'm keeping my shoulder engaged and forward, and I'm pushing that direction. So I'm pushing towards the other hip. And that can be amazing for TFL and stuff like that. Like right now, I can feel my legs because this table is not high enough for me. But getting that pressure there, and I can be relaxed. This is just my shoulder set in place. I'm just putting pressure as if I was doing loose fist, but it's just through the elbow. And we're just going around finding what's there, working in through it. The other thing, again, bony landmarks are the best part of this because you can just trace them. You can find all the individual muscles if you want. And if they have piriformis syndrome, like form of sciatica, definitely do that. But you can find working along iliac crest. You can do very structure-specific work just along there, the attachments of glute medius. You can do even more Swedishy kind of little sweeps and scoops and stuff like that. And then you'll find the sacrum, and you can work down the sacrum a little bit. I would stop once you're even with greater trochanter and shift over there. Because any work that you're doing even further down is getting into an area that for most people is going to be uncomfortable, and you kind of question whether you're in your scope at a certain point. So probably avoid. But this, going around iliac crest, tracing that, tracing down sacrum, jumping over, and working all around greater trochanter, which can be very, very slow, deliberate work. You can find little attachments like, ooh, that little one right there. Yeah, you just find little things that are attached because trochanter has a million billion things attached to it. A little bit harder coming into like TFL and stuff like that, just because the angle is a little bit difficult. Once you guys get good enough to do this and you can be comfortable stacking your thumbs, has to be pool cue, and I have them brace with each other, and it's just gentle little work going into TFL, and it's the same thing. My pressure is going that direction, and it's not a lot of pressure. And I have them supported. They're not doing work. My hands are tented here just for support and guidance. They just sit there. They're not doing any work here. My hands shouldn't move pretty much at all. Just going in, you can go along the length of things, across. How's your TFL doing?
Pretty tight.
Yeah.
That's good.
Yeah. And it's all this is shortened, softened. You can get more access. And I figure with the sequence, there wasn't as much stuff that you had available, but doing that, working along those bony structures, working in 3 dimensions as well. So working this direction, working down. The other thing that you can do is getting a little bit of like compression and drag going this direction. You can do myofascial just going in through here. That is always an option, and probably start with that. But just going in, I've shown you guys some of my traction stuff. It's not quite that, but you're just pressing kind of in, pulling away the same way we would scoop away with our elbow, but this is just kind of open hand, a little bit gentler, a little bit less. We're just going along wherever we can, finding little things, little tensions like there. I might want to explore getting a little bit more work getting this tension released, because when I'm going that direction, I'm getting a good amount of resistance.